Let me shift for a moment because you also work with ADHD. And this is a diagnosis that comes up a fair amount, I would say, in couples that I work with, and I think with couples that you work with as well. And I'm very curious to hear your thoughts on how that does influence couples therapy, a relationship. What should they be aware of or be thinking about?
I think, yeah, we tend to see this a lot, like a neurotypical partner and a partner who's neurodivergent, ADHD being sort of one facet of that neurodivergence. So I think one of the misconceptions is just how sort of simplified people's understanding of ADHD can be. And whereas I work really hard through just like helping educate my clients about just really expanding the symptomology, like the list of symptoms and how ADHD shows up. And so when we think about couples, ADHD is often affecting emotion regulation, organization, follow through, memory, time management, responsiveness, and we can just, I'm sure anyone listening can hear and imagine all the ways that can get in the way of a couple and a couple trying to live their lives together. Over time, couples can also develop really painful narratives about each other, right? Like the neurotypical partner could start to feel really alone, like burdened by like all the administrative tasks that come with like being a couple. They can kind of start to step into somewhat of like a parental role. Did you do this? Did you forget this? Don't forget to do this. And the ADHD partner or the neurodivergent partner might start feeling, easily criticized, like micromanaged, like they're constantly disappointing their partner. And so both partners are really hurting and they're responding to those hurts rather than sort of recognizing the role of the ADHD itself. So I try to help couples separate the partner from the condition, right? And like work together against the problem instead of against each other. And this is not to say this is like easy work, it's challenging, but so much hopefulness can come from even just understanding how the neurodivergent piece is playing a role in the system.
In my experience with just about any issue with a couple, both people have to make some move towards the other person. In a situation like what you're talking about, what would be an example of each partner moving a little bit towards the other partner?
Yeah, I think both partners can get more curious about what the other is needing from the other, right? The neurotypical partner can really acknowledge like, this is a struggle for you. These things that are maybe easier for me, they're a struggle for you. Is there a way I can help you help yourself? And then in turn, that would help me with these things that I'm feeling really burdened by. And really leaning in gently, moving away from the criticism and moving towards, I know this is hard for you, and it's also hard for me in these ways when I have to manage you and me. For the ADHD partner, I'm working against that defensiveness when that partner wants to sort of say like, but I do so much, or, and really hearing, okay, that this has an impact on my partner. What are small ways that feel manageable for me to help them with what they're asking for? But yeah, it's a layered conversation for sure.
Yeah.